RadDOPS is the acronym for Radiological Direct Observation of Procedural Skills. It forms one of the two main workhorses of workplace-based assessment. In it, an assessor observes a trainee undertaking a clinical radiological procedure. It can be used across a wide variety of clinical settings and encompasses all modalities. The assessment takes little longer than the actual procedure, but importantly allows immediate feedback to the trainee. If we now look at the RadDOPS form, the first thing to fill in is the assessor's registration number and the date of the assessment. If the assessor is a doctor, this should be the GMC number. If it is an allied healthcare professional, the society number is most appropriate. There is then the opportunity to contextualize the assessment in relation to the clinical setting and the modality. The trainee's previous experience with the case mix can be annotated, as can the difficulty of the cases. If we now look at the domains used in RadDOPS assessment, you will see that most are self-explanatory. Those of most relevance would include the ability of the trainee to explain the procedure and take informed consent from the patient, the fact that the trainee can undertake the procedure in an appropriately aseptic manner, that where ionizing radiation is used, the trainee uses this appropriately, and probably most importantly, when looking at a practical procedure, the trainee knows when to stop and seek help. There is the opportunity in the RadDOPS to look at the overall clinical competence of the trainee. In order to allow you to do this, we have developed 4 ratings. Finally, there is the opportunity for feedback by both the assessor and the trainee. This takes the form of free text boxes, which are mandatory to allow completion of the RadDOPS.